Hello, everyone. Welcome and thank you for joining the 33rd webinar in our Pandemics and Society series. Today's topic is Optimizing Wastewater Surveillance to Detect Outbreaks and Track Diseases. I'll now pass it to our moderator, Jennifer Nuzzo, Director of the Pandemic Center at Brown University's School of Public Health. Jennifer?
Hello, everyone. Welcome to our discussion. Originally used to track asymptomatic and symptomatic poliovirus infections, wastewater surveillance is now being used across the globe as an additional tool alongside clinical surveillance to aid in detecting and monitoring pathogens. And this approach gained a lot of attention during the COVID-19 pandemic, when wastewater surveillance really became quite a reliable way to track infections after the widespread adoption of home testing, the results of which didn't turn up in traditional public health surveillance systems. But since the pandemic, the use of wastewater surveillance has expanded, and it now includes additional use cases, such as enhancing surveillance for other, say, endemic respiratory or enteric pathogens, to provide early detection of emerging pathogens like H5N1 bird flu and reemerging pathogens like measles. And so there's increasing interest in this tool as a supplement to surveillance and other use cases, such as potentially using it to provide early warning of future biothreats, such as emerging pathogens, disease X, those sorts of scenarios. So lots of interest in wastewater surveillance. But as with any new surveillance approach, there are many questions about it. And some of these questions include scientific questions about what sorts of pathogens can be reliably detected, questions about whether that would include being able to detect unknown pathogens. There's also some debate about how actionable wastewater surveillance may be. And then, of course, with any surveillance system, there are questions about sustainability, and particularly because many of these systems have been funded with pandemic era funding. And so the question is, what's the future of wastewater? What are we to make of these questions? So that's what we're going to discuss today. And to help us unpack these issues, I am joined by three experts in the field. First, I am joined by Jean Richards, who works as the Biosecurity Director of SICPA. I'm also joined by Nicole Fehrenbach, who serves as the branch chief for rapid response research and surveillance at the Centers for Disease Control and Prevention. And I'm also excited to welcome Abigail Paulos, who is a postdoctoral fellow for the Gangarosa Department of Environmental Health at Emory University Rollins School of Public Health. So thank you all. Thanks for joining us. So let's dive into the conversation. So maybe first, if you could each just give us a little bit of background in terms of your involvement in wastewater surveillance. I think it'll help the audience kind of put into context the rest of the conversation that we have. So perhaps could I start with you, Nicole?
Sure, and thank you very much for this opportunity. It's a pleasure to be part of this panel today and to join this conversation. So I had the pleasure of joining CDC's wastewater surveillance system as its branch chief in late 2023. So I'm newer to this. My educational background is in health policy, information technology, and analytic methods. And my previous experience here at CDC has been in leadership positions to advance interoperable public health information systems, research and surveillance in birth defects and developmental disabilities, and public health emergency response, supporting state, local, tribal, and territorial health departments. And given wastewater's emerging success as an early warning and ongoing monitoring system for infectious disease outbreaks, I was honored to join this leadership team in 2023.
Great. And Abby, I'll turn it over to you next.
Sure. Yeah. Thank you so much for having me on this panel today. I'm always excited when somebody wants to talk about wastewater with me. So thanks so much. My background is in environmental engineering. So I studied how pathogens were transmitted through the environment before moving into wastewater after I finished my PhD 3 years ago. And so that work kind of naturally led me to start thinking about wastewater surveillance, which is kind of thinking about these transmission things at more of the community scale. So I've spent the past few years working on wastewater monitoring as part of the wastewater scan program. And I've done a lot of work on developing the evidence base for wastewater monitoring of new targets like measles, tuberculosis, or influenza A, H5N1. And then I also do a lot of thinking around kind of what weird things like avian influenza that can get into wastewater and how they get into wastewater, and then how that affects how we can interpret our measurements.
Great. And Jean?
Thanks as well for the opportunity to be here and for including me in SICPA. So my background is in veterinary medicine, and ever since leaving private practice, I've really been working at the interface of biological threats, pathogen surveillance, health emergency preparedness and response. I was with the U.S. Defense Threat Reduction Agency and also with the WHO's Hub for Pandemic and Epidemic Intelligence in Berlin, and with both organizations working directly with countries to support them as they were strengthening their pathogen surveillance and public health intelligence capabilities. And when I was at the WHO Hub, I was working with colleagues to really coordinate efforts across the organization because coming out of the pandemic, this was really the new shiny tool on the block, much like genome sequencing and genomic surveillance had been, not too long before that. And money was kind of falling from the trees, if you will, and countries were really excited to build their capacity in this space, but it wasn't all coordinated. It wasn't very standardized. And as you can imagine, across WHO, there were so many different experts and groups that were helping member states as they were navigating this. So we really needed to be strategic and coordinated in our efforts. So I worked on that and then also was working really closely with the European Commission, which had been heavily investing in and advocating for wastewater surveillance globally. They established a global wastewater and environmental surveillance consortium, and I was working closely with them on that, really with an aim to institutionalize wastewater surveillance and establish a global sentinel surveillance system. And so all of that led me to this role in SICPA, where we're really building public-private partnerships with countries for sustainable implementation of wastewater surveillance and ensuring they have sovereign systems. And we're working specifically in the aviation sector.
Great. And so each of you are involved in wastewater surveillance with different types of networks and approaches. And so I'd love your general thoughts on the utility of wastewater surveillance. Obviously, it is being used right now in a variety of different ways, but I'd love to hear from you sort of what you think its main contributions have been, or maybe some particular use cases that you're excited about. And if in talking about that, you can maybe explain a little bit about how each of you how the efforts that you're contributing to work. Because I think people hear about these different approaches and so maybe think they're all the same, maybe they think they're different, and it'd just be helpful to kind of understand how these different surveillance networks work. So maybe Nicole, I could come back to you on that.
Sure, thank you. So here in what we're doing domestically at CDC at the community level is we are receiving information from approximately 1,500 different sewer shed sites. So different public utilities are working in partnership with state and local health departments or with academic partners such as Wastewater Scan, who's on this panel as well. And then also CDC has a national testing contract. And so that has built a network of sites across the nation that provide data. Some are sampling weekly, some are sampling twice weekly, some are up to 3 times a week. And all of that information is reported here to CDC, and we collate that information to tell us what is happening at a community level and how can we aggregate that regionally and then nationally. And the way that we view this tool is it's been very adaptable for us to be able to detect new outbreaks as well as track disease trends. So it's able to serve 2 distinct purposes in public health. It lets us know what's happening at that local level, and can we see an early warning, as well as is there a spread from what is happening from one community to another. It's an efficient system, so we've been able to use a single sample to give us information about hundreds of thousands of people in a community. So a very efficient use of public resources. And it's independent. It is not, as we've really seen with COVID and influenza with more home testing, it is not constrained by people maybe not seeking healthcare or doing home testing, or if they're in spaces where they may not have access to healthcare. In addition to that, it's anonymous. And so one of the real powers that we see that this network brings and its utility is it's not dependent upon an individual with their individual test result and having any of those privacy concerns. We are much more concerned about what's happening at a community level, so where you have input from many, many folks. And that is timely. From flush to report to us is about 7 days. And that can be quite efficient when compared to some other ways that we get data in the public health system through mandatory reporting, hospitalization, discharge data, or other commercial inputs. There are a variety of these systems that work together, but those are some of the key characteristics that we see that provide utility about how we are able to utilize wastewater surveillance information. In addition to that, because we make our data publicly available, we're very transparent in the information that we receive. We update our website every single Friday, and we have recently revamped it to have those disease trend monitoring by common respiratory viruses, and then we have specific pages associated with emerging viruses. So it's one-stop shop for the public as well as healthcare personnel to be able to get information to utilize that for individual decision-making and community-level decision-making.
Thank you for that. And I want to come back to the comment about it being anonymous. But first, I want to hear from Abby because Wastewater Scan operates similarly, but a bit differently. So could you maybe explain a little bit about how it's similar or different? I know you two, Wastewater Scan and CDC, do work together, but how it's different, and then also sort of your thoughts on the use case that you're excited about for wastewater.
Yeah, so Wastewater Scan is a bit of a unique program in that we're academically led. So we have about 150 sites around the country, and they're each sending us about 3 samples a week on average. And so we get all of those samples shipped to our lab, and we process all of those centrally using the same methods. And being academically led, we're really focused on kind of moving the field of wastewater surveillance forward. And so we're able to do a lot of research into things that are kind of risky, that might not work, using all of this national network of samples that we have. And so in each of those places where samples are coming from, we have public health partners, we have partners with the utilities who are collecting these samples for us. And what we've learned and what we hear from them is that wastewater surveillance can really help fill gaps in the traditional public health surveillance systems. So as Nicole already said, we're capturing everybody in the sewer shed, not just those who are going to hospitals or clinics and being tested. We're capturing everybody. And so we can get a more complete population level picture of disease transmission. And what we have found at Wastewater Scan is that the utility of wastewater monitoring really depends on the pathogen. So some pathogens, it can be really useful for tracking trends of those over time, or launching interventions like vaccination campaigns when we see levels start to go up. And that's things like respiratory pathogens like flu, COVID. But then in others, it can serve as an early warning system. And I think this is the use case that I'm most excited about right now, is that of measles. We've found that clinical cases can be really underreported or delayed for measles. And this is a situation where our wastewater monitoring that we've been doing for measles for nearly a year now has been able to give early warning in multiple different situations of an outbreak. So, for example, our public health partners in Michigan, we had wastewater detections at the plant there, and they used that information to trigger vaccination campaigns in the area, and to identify cases in the area. And so that's one pathogen where doing the wastewater monitoring give you early warning and let you act kind of faster and respond before there's a more widespread outbreak. So yeah, that is the use case that I'm most excited about. But there is, as an academic program, we are always kind of thinking about what are new things that we can do, what are new things that we could measure, or new ways that we can process our samples. And so another thing that I'm really excited about, and hopefully we'll get a chance to discuss this more later, is our metagenomic sequencing. So we're kind of just starting to pilot some viral metagenomic sequencing at Wastewater Scan. And I feel like we're really just starting to scratch the surface of what we can learn from this type of analysis. And so I'm really excited to see where that can take us in the future.
That's great. And I do want to talk more about measles and what we're learning about measles from wastewater. But Jean, if we could turn it over to you, I know you working more internationally. If you could talk about the use cases you're excited about in that context, and also, what sorts of surveillance are you seeing in being used?
Yeah, I mean, it really adds value in so many contexts. Our work is focused more on the, early warning of new outbreaks, kind of context and helping countries strengthen their border health security. And of course, early warning of infectious diseases as they're crossing into your country gives you a head start in many different ways, alerting healthcare providers and labs, guiding the public, implementing additional screening measures, procurement of medical countermeasures or development where needed, PPE. There's so much that early warning is really valuable for. And, as a utility beyond public health surveillance, a good colleague, friend and colleague of mine in the European Commission, I have to give him credit for this. We have to stop calling it wastewater. It's a national treasure. It's not waste. And is always saying, and is trying to really change the mindset of wastewater and calls it used water intelligence, which I really like because I think it speaks to the multi-sector value for governments of this tool. So some of the use cases, of course, it's absolutely relevant for pathogen surveillance, antimicrobial gene detection and monitoring. And this benefits, of course, not only public health, but also animal and environmental health, livestock industries. But it also generates other public health insights, substance use, pharmaceutical use, mental health stress, chemical pollutant exposures, endocrine disruptions. I mean, there's so much that's really not routinely used for that I'm excited about. Of course, it can really aid in the detection of a potential bioterrorism event. It can aid law enforcement in investigating that, triangulating back to, potentially the source if there were multiple sites where something was introduced in attribution. There's a lot of interest there in the security community. Other applications as well for law enforcement and regulatory agencies in terms of detecting trace explosives or nuclear materials that can provide intelligence for like illegal bomb making operations, radiological incidents. So it's really broad spectrum and it's not necessary. It is being used and it has been proven for a lot of those that I just mentioned. But what I'm excited about is the fact that it's a tool that provides value across the sectors. And I really believe that if the relevant ministries or departments and agencies partner together within the country to share the cost of establishing or maintaining the infrastructure and supporting the workforce, it can become a more sustainable tool, even in low resource settings, because, outside of high income countries, it really is, it absolutely nearly 100% supported by external funding. And so really trying to think through how it can become more sustainable is something I'm really excited about.
So I started off talking about COVID, and in COVID, when we started seeing a wider spread availability of home tests, I mean that was an important innovation in the pandemic because for many people it was just simply easier to test at home. For many people, they much preferred having that confidential test result at home. They'd be more likely to be tested because they could act on that information themselves and not have other people involved. Of course, when people test at home, it doesn't get captured in the same way that data from the laboratory or doctor's offices might. And so public health surveillance starts to erode. And so there were some attempts to think, could we claw back some of the data from home tests? I would say, in my view, a lot of those efforts probably produced very biased data where you only get people submitting test results. The people who would submit their test results are probably quite different than the people who wouldn't. And so wastewater really helped step in to give us a sense of where in our communities were we seeing infections, were the infection, were the trends getting worse, were they getting better? That said, there was a lot of grumbling about wastewater in public health circles. A lot of people arguing, and they'd argue still, that it's too noisy to make sense of, or it's too not specific enough when, in a field that's used to having line level data, meaning who that person is, who's sick, and where they live, and what day they showed up to be tested. In a field that's been historically dominated by that, I think a lot of people argue it's too noisy, too non-specific, not actionable enough. Question for all three of you: what do you say to those arguments? Have we learned? Is that true? And if so, what do we do about it? Is wastewater still useful? I think you've described situations in which it is, so I doubt you're going to say no, it's not useful. But what do you say when people say that? And whoever wants to chime in first, maybe Nicole. I'm sure you probably hear that from our public health partners.
Yes, and thank you for the question. One of the challenges with wastewater surveillance is exactly what you identified. It's a complex matrix. So there is a lot of noise in that sample. And there's really good work being done in this field now to try to address that. And some of that is through some of the sequencing work that Jean alluded to earlier and Abby brought up as well. And I think overall, wastewater is a piece of a puzzle. One of the things we do very, very well here in public health is we gather information from a variety of sources and mold them together to try to understand the context wherein we are seeing some signals or some cases and then taking appropriate action. And there's always context to the work that we do. Wastewater surveillance, as you noted, is newer at this scale for these range of purposes. And so it can tell us whether a virus is present or absent. It can tell us if the levels are high or low. Is it decreasing or increasing? What it's not going to get us very easily to is what exactly this signal means for how many human cases there are. There's a correlation and a relationship. But there is not a one-to-one at this point in time, and it's going to vary by the pathogen we're looking for, how common or rare it is, how large the sewer shed is, etc. So there's a lot of complexity to that. That said, it does fill gaps where we have limited clinical surveillance. And as Abby was bringing up, measles is an exceptional use case in this space where the communities that are impacted are traditionally are closed and not as connected with our clinical healthcare infrastructure. And so therefore, healthcare seeking behavior is going to be delayed or completely absent until things may be at a crisis level. And so in instances like that, in some of these vaccine preventable spaces, wastewater surveillance is providing us with some important clues as to what is happening. And we can share some resources. There's been some work done by Oregon recently where they did a retrospective analysis and they identified wastewater signals 10 weeks prior to identification of a human clinical case. And so that gives us a sense for this particular pathogen of where it can be really valuable. And again, we alluded to this, all three of us have mentioned this, that it can be a very cost efficient system. And in particular, I like what Jean was referencing, and when you bring together different agencies, different entities that can have a stake in the result, if we think about how to spread the cost of that infrastructure, it can be dramatically reduced, as opposed to how much data we can get from one wastewater sample compared to thousands upon thousands of clinical cases. It can be a leading edge. And so we do have some experience even with things such as RSV. We had a health department recently report to us that they were using specifically RSV data to look at whether or not to extend the use of nirsevimab in infants meeting certain criteria during the RSV season, which is typically fall through spring. And what they were able to do in this particular instance is actually pair the wastewater data with some of the clinical data and show that RSV rates were decreasing. So that gave the health department two different data insights to say that they did not need to extend their vaccine campaigns. They provided that information to the providers and they were able to save people time and resources. So I think that's a nice use of where this data can be helpful in very specific ways to how we allocate resources, how we use people's time, and also how we can get that early warning system where we may have populations that we aren't typically interacting with on a day-to-day basis from the healthcare clinical setting perspective.
Yeah, that's really interesting, that case in particular. I know in some instances there was concerns that the RSV season was a little delayed in some places and that had real consequences for what actions should be taken. Yeah, that's interesting. Abby, Jean, anything you want to add to that?
Yeah, I would add, I really agree with the point you're making, Nicole, about how wastewater surveillance is something that kind of fits into our existing and adds to our existing public health surveillance. So this isn't something that we're suggesting should replace any of our clinical surveillance, right? Bring me, like, if you can find a public health person who tells me that the traditional public health surveillance system was perfect and ideal beforehand, great. But we think of wastewater as like something that can really fill in those gaps and that together with those existing systems can really improve our surveillance and allow us to act in faster and better ways. From the wastewater scan perspective, we have a lot of evidence because we've been doing this for several years now that our data is useful and actionable to our public health partners. When we're thinking about what should we be monitoring for, what new things should we add, kind of the most important thing that we're thinking about is what would be most helpful to our public health partners. Um, and that's kind of our driving force for what we're doing. And so over the years, we've added new targets in a pretty rapid way as public health needs have arisen. And so measles is definitely one example of that. But we've also added in monitoring for Mpox, Clade 2, and now Clade 1b, first in 2022 and more recently for 1b, when our public health partners were indicating that that was a concern and that there were gaps in that clinical surveillance. Um, and there's just a number of use cases. You know, if I sat here and listed all the ways that our public health partners have found this data to be useful, we would be here all day. So I won't do that. But I would say it's a lot of work to collect all of those wastewater samples and ship them to us, right? And we've been doing this for a number of years, and our partners are still choosing to participate. Like they are still seeing the value in the wastewater data. And so we see that as useful now, but as researchers, we're also thinking about how can we make this more useful in the future. So something Nicole mentioned is that, you know, we see this signal in wastewater. We see a certain concentration. We don't know how many people that corresponds to necessarily, but something as researchers that we can think about is doing shedding studies. So when somebody is infected with SARS-CoV-2, let's say, how much of that virus is being shed in their stool or their urine and getting into wastewater, and kind of making it easier to do those conversions from concentration in wastewater to number of people. And so that's something that we can improve moving forward as well.
You know, I got my start in I started off as a practicing epidemiologist at sort of the early days of syndromic surveillance, and there were very similar questions about syndromic surveillance. And I think one of the things is like, what is actionable? If the data prompt you to look in another data set, that is actually an action. That's an important action. That's part of the workflow, that is inherently about triangulating your way to the truth through multiple data sets that have different strengths and weaknesses. So, but Jean, looks like you're going to add something.
Yeah, a couple of things. One, I would say, give it some time. It's still relatively
Mhm.
new. And to Nicole and Abby's points, there are very clear, well documented,
Mhm.
there's, evidence that it is valuable, and it is actionable. So there will only be more of that. So, don't be so negative. I would say give it some time and read the studies. We're working in the aviation wastewater testing. So I encounter skeptics that say, oh, well, nobody actually used the toilets on planes, or only a low percentage of people use toilets, and testing wastewater from airports isn't that useful because you don't really know if those people are really going to enter your country. Are they transiting passengers, or where are they going? So what are you going to do with that? And no one ever says aviation, testing wastewater in aircraft or in airports is the silver bullet that's going to save the world from the next pandemic. But it, of course, provides early signals that are part of a sea of other signals. And when analyzed alongside other data from traditional surveillance, open source epidemic intelligence tools, livestock, wild, we've mentioned a lot of those sources here. It is useful. And the reality is many people do use the toilets, and many epidemic and pandemic prone pathogens are shed in urine and feces on airplanes. And many people that are using the toilets are entering your country. So while of course it's not going to catch everything, it's going to increase the likelihood that you're going to see an important signal earlier than you would if you weren't looking.
So we do have people, I think, who are, so on one hand, the negatives, but on the other hand, there are some people who think that this is the greatest thing since sliced bread. We have a little bit of a shiny object phenomenon where they think it's going to do everything for us now. And I just want to, kind of set expectations and understandings at the other side, which is what do we think it can't do? Or maybe more specifically, and I see some questions accumulating here in the Q&A, and encourage other folks to put questions in there. But we both in the Q&A and in pre-submitted questions, people want to know about detecting unknown unknowns, which would, correct me if I'm wrong, require different approaches scientifically. Abby, you were talking about metagenomic sequencing. Where are we on that? Can we just have what is the current state of the science on that? What can we do now? What do we still not able to do, or what are we working towards? And whoever wants to chime in, maybe Abby, since you brought it up, I'll turn it to you.
Yeah, this is a great question. Thanks for bringing this up. Um, So I would say for the unknown unknown, first, maybe let's talk about what our current gold standard monitoring approach is. And so that is typically a PCR approach, where you kind of have to know what you're looking for and design a test specifically for that pathogen, that target. And this is something that we can do really well. So, given a specific target, we can design a test for it, we can evaluate whether it works, and we can kind of roll that out and give other labs, other people the assay details so that they could also run that same test. This is something that we could do really well and we can do really sensitively, meaning we can, with these methods, detect a really small amount of virus or pathogen in wastewater.
And can
Um,
I just pause 1 second there before you move on to the other situation is, are there pathogen, like, can you detect all pathogens in wastewater? Or are there certain diseases and conditions that we might cause outbreaks that we might want to monitor that are still hard to detect reliably in wastewater?
yeah, this is where it gets really tricky. And it's something I've been thinking a lot about in the past year or so. So with our, wastewater monitoring, this really started during the pandemic with SARS-CoV-2. And we can measure and detect SARS-CoV-2 and a number of different viruses. Well, the issue can come when we're looking for other pathogens, especially bacterial pathogens, where they're much more similar between different species. So, for example, I've been doing some research on Bordetella pertussis in the past year or two and seeing if we can monitor pertussis, which causes whooping cough in wastewater. And we've had this issue where there are 3 or 4 species that are very similar, but only one of those is a human pathogen. And so
Mhm.
designing a test to target just that one specific human pathogen can actually be a challenge. And this is just kind of one example of bacteria, but this is kind of a growing field in wastewater monitoring, kind of the expansion beyond these viruses that we were initially thinking about and moving into bacteria and kind of other types of pathogens. There are more challenges with monitoring those that we have, as researchers, are really starting to kind of grapple with as we move forward. If anyone wants to add anything to what I'm saying, feel free to jump in. I see some people nodding along.
Yeah, yeah, I think Abby is stating the challenges very, very eloquently. And Wastewater Scan is one of our academic partners, and they have really been at the forefront of this field, pushing the envelope on what is possible. For I think everyone's awareness right now at CDC, our domestic wastewater surveillance program focuses on using very targeted digital PCR-based approaches. And so that enables us to, at a relatively low cost, have high sensitivity in what we're testing for. And we test for a range of respiratory pathogens and a few emerging pathogens, such as measles, monkeypox, and H5. That said, we are leaning towards the future of what can be done using next generation sequencing, using metagenomics to enhance our situational awareness, see the information that's out there to inform decision making at the public health level, whether it's for public health emergencies or for ongoing biosecurity monitoring. That said, the cost of metagenomic sequencing is something we are also paying attention to. And so we have a few of our centers of excellence. CDC has 6 wastewater centers of excellence. A few of them are also leaning into this area. California with Wastewater Scan is one of them. We also have our partners in Colorado as well as in New York State, and leaning into this area and some exploration happening with a few of the others as well, with Wisconsin, North Carolina, and Houston. What we are thinking about from a public health implementation perspective is where we can have that type of work done reliably, where can that cost be absorbed, and then at how many places do we need to be doing that at a national level for that data to be actionable from a national security perspective, as well as then translated to boots on the ground public health action. Anything we do from a CDC perspective should have application at the local community level in partnership with our state health departments, territorial health departments, and local health departments. So there is that bridge we're always trying to build. And we do have sequencing information for a lot of pathogens that are available when we think about the metagenomic approach. There's a lot also that we don't know. And so there's been some really good work by some of our partners where there's about 20% of a sample that can be sequenced. That leaves 80% that's unknown. That's a big task ahead of us. And I think one that the field is starting to rise to. So I think there's a lot of promise for the future. Right now, at this day, there's questions that we're asking ourselves about how to really interpret that information well, and then what is its clear alignment with public health action.
And Abby, I kind of stopped you in the mid thought, but I didn't know if you wanted to add anything because you were getting to the kind of unknown testing question, if there's anything you wanted to add to that.
Yeah, I just wanted to say, so, as a field, we lean a lot on these targeted approaches using PCR to look for something we already know exists. Um, to do that kind of untargeted work where you're looking for that unknown, this is where you have to move into sequencing, right? This is something that as a field, we're just trying to figure out now how to do well. And it's a really tricky thing to do because, as has already been mentioned, wastewater samples are really dirty. And it can be really expensive and time consuming to sequence those and sequence those well. And it takes a lot of expertise to generate and process the sequencing data. So it does give you the opportunity to find things before you even know what you're looking for, and detect those emerging pathogens and those unknown unknowns. But it is much more challenging, and the science is really just starting to gain speed now. So I think an interesting example of this is that of H5N1. So wastewater scan, we started our wastewater monitoring for H5N1 in spring of 2024, so nearly 2 years ago. And we are using a PCR approach to measure this in all of our samples right now. But there actually was some data that came out from near one of our sites where we later tested H5, that they found it in sequencing data from that site before we even had the time to set up our PCR test and get that going. So that was detected in sequencing data before we could spin up our PCR. But the issue at the time was it wasn't clear how much that mattered. Like it wasn't really flagged as something of importance. And that's kind of the issue when we're doing this sequencing is that you get so much data. When you're looking for the unknown, you're looking for a needle in a haystack. And that can be really challenging to know what's going to end up being important. And so I think sequencing is something we're going to be seeing a lot more in the future as the field develops. We're going to be seeing a lot more research coming out around how to process samples, generate the data, and then how that data can be actionable to public health. And this is something that we as Wastewater Scan are piloting now with our partners in a few sites. And it's a huge undertaking. We have a lot of staff working on this sequencing part of our program, and they are putting in a lot of time and effort to understand the data and then to figure out what do we bring to our public health partners, what do they want to see, what is or isn't actionable to them. So this is something I'm excited about for the future, but we'll kind of see how that unfolds over the next months and years.
And part of the premise of sort of the early detection of, say, Jean, you brought up, bioterrorism or some kind of agent that you don't expect to see because it's a novel pathogen. So part of the premise is that you would detect it very early, but then there's a low prevalence issue. And I'm wondering if some of the scientific challenge pertains to levels, limits of detection when you're dealing with low prevalence infections. And does it have to be a certain level of incidence in the population in order to detect it reliably? Is that coming up? Are those issues? Anybody who wants to answer that?
I could start, and I think Abby has a similar experience in this phase. I think monkeypox virus, both clade 2 outbreak and clade 1 outbreaks, have shown some of the challenges in wastewater surveillance for these very, very rare events, and how confident we are in those results. So we have situations where we had very, very low, below limit of detections over time that were able to correlate with the case. And so we had lots of data inputs, but the value was technically below the limit of detection. Then we've had others where we've had an interesting spike and a high detection and then we were never able to find the clinical case. So it can be quite challenging in those. And that's where it is very important, as Abby noted earlier, that we use those detection information in context with what else do we know about where the detection's taking place, what occurs within that community. Is it a travel hub? Is it a place? Was there a special event that recently took place there and that brought a lot of people together who then dispersed? So it is a real challenge, and it's a challenge whether we're looking at regular concentration data from a wastewater sample, as well as then in this complex matrix when we start doing sequencing. And then the other piece with the sequencing that I'd say that can be quite challenging is whether it's a rare event or not, is the degradation of the virus or the bacteria that happens over time and how they can split apart. And so that we may get a piece of a viral fragment, and that's what we're able to sequence, but it's not going to be that whole genome being sequenced as easily as you would in a clinical sample.
Mhm. Um, what if we find something that we don't expect to see? Do we have worked out plans for how to handle that test result? Because I'm thinking of the early days of the BioWatch program, which is for those who don't know, it was a air monitoring program specifically looking for bioweapons agents. And sometimes it would find something. And then the question was, well, what do you do about this result? And that not having clear protocols in that context create a lot of consternation. There were actually hearings about, the systems and whether they were doing what they said they were doing. A lot of frustration. So I'm just wondering, have we learned those lessons in wastewater surveillance? Do we have the right protocols, or are we thinking along the lines of protocols for triggers for action and what those actions are for things that we may not expect to see?
Yes, Jennifer, absolutely. So we are leaning into that. I would say the protocols do not fully exist right now. What we do not want to be is something that provides a detection with no clarification about how to interpret that
Yeah.
and no link to action. So we want that clarification. We want to understand confidence in that detection. What does it mean? What select
Yeah.
agent protocols and requirements and security efforts now need to be brought into play? As well as then how do we communicate internally with each other across, so for us in the US, our domestic layers, so how are we communicating with our state health department, with the local health departments, how are we going up our federal chain of command to ensure that we have line of sight? How do we not overstate? And
Hmm.
so putting those guardrails and parameters up for ourselves so that we have an appropriate protocol for what we may detect. And how do we maintain fidelity and reliability as CDC when we call a detect?
Hmm.
So those are all very much on our mind as we're leaning into this space.
And Jean, yeah, I was going to ask you on the global context, what the current
Yeah,
state is. Yeah.
this is definitely something that's coming up a lot, and there are a couple of regional frameworks for so the European Union, and also actually just launched this week is the African wide continental wide strategy for wastewater surveillance, and I think at the end of 25 the EU published their framework for integrating wastewater into traditional surveillance. But this comes up, and providing so the thoughts and discussions are not just happening, of course, in the US, but other ways too. And I'm not privy to kind of any particular countries, plans and protocols and exactly what they would do, but they're absolutely having these discussions as well. And not just what to do when, you're using metagenomic sequencing and you find something, but also when to use it, because it is still very expensive, as Nicole mentioned, but it's very important because, of course, the goal, outside of the research setting is to generate data for government action. But some key decisions absolutely rely on what subtype, what strain, what AMR profile, a detected pathogen brings with it, and so. These kind of regional entities, and Africa CDC is largely leading the African continental wide strategy, are really trying to help as well member states to think through that, because there's a lot of energy around it. There's a lot of excitement about what it can do. And then what? So
Yeah.
these discussions are absolutely happening as well in other parts of the world.
So I'm going to turn to the questions that have been submitted in the Q&A box. We have a bunch, which is great. I'm going to try to lump a few of them so we can answer them before the hour is up. There's a question about wastewater environmental surveillance in resource limited settings where sewer systems are non-functional, and this specifically references sub-Saharan Africa. But there's a later question about sort of, are we capturing everybody? Are there biases in who we're capturing? And so you can also extend that to other countries that do have systems, but perhaps there are rural areas, et cetera. And so anybody who wants to kind of weigh in on those issues about conducted in the context of places where sewer systems are not um, uh, there, but also sort of the generalizability or potential bias in these surveillance approaches.
I can start with that one. It's absolutely a challenge and a benefit, where there are so many countries where, less than 25%, in some cases, even less than 10% of the population is covered by sewage systems. And it's challenging because not only logistically is it difficult to collect the sample and to get to some of the remote areas, but you can also you hear reports of communities really pushing back, not understanding it, the distrust around it. So it's not an easy thing to do, combined with the fact that the sample is often, exposed too long to, high temperatures, or, of course you have the dilution impact of significant rainfall in some areas and flooding. So it's really complicated, and it's really beneficial where it can be done because you have many aspects of the population that, they don't have sewage systems, but they also don't have access to, clinics and labs, and the healthcare infrastructure is really weak. So being able to collect intelligence around, the threats that they're facing is really important because it's really a blind spot for the government, for public health surveillance in a lot of these areas. So it's challenging, and it's really valuable.
Yeah, and I would add to that too. I feel like when we're thinking about abroad in low-income contexts where there are non-sewered systems, there are some people doing really interesting work in these settings, collecting samples from open canals that collect wastewater, and other places that are a natural wastewater sample, but that aren't part of this piped sewer system that we're typically thinking about when we talk about wastewater surveillance. But to me, I think one of the biggest factors in how to do this well is around, I think we need some kind of technological innovation, because the testing that we typically rely on, that I've talked about before, where we're doing PCR, we need electricity, we need usually a sterile lab setup, we need a lot of resources. And so I think that an area where we kind of need more innovation and more research in is, can we do this in a less resource intensive way? So can we develop something like a lab in a suitcase that we can bring out to with us to these rural sites, to process samples rather than collecting samples, transporting them hours away to a lab in a major city? Is there ways that we can bring testing to other people? And this is an active area of research, something that I'm personally really excited about, and that I hope we really can kind of bring this level of innovation to bring wastewater monitoring to a much larger group of people in the future.
And there's some really interesting comments in the question and answer that are more like sharing scientific information about these approaches. So just to say, it sounds like we need a conference to talk about the science here
Absolutely.
and to optimize. There are questions also, though, around both the timeliness, sort of like the period of time that we're capturing and publishing data, and then also about, and Abby, you already sort of referenced this a little bit, but questions about translating the viral concentration to infections or numbers of infections or prevalence. And there are some questions there about like how much people shed. And that seems to be inherent to that question of can we take this viral concentration data and figure out how many people are likely getting infected in this given period of time. So sort of where are we on that? Can you say a little bit more?
Yeah, so there are definitely ways with our current state of knowledge to try to back calculate how many people who are infected, um, given a certain wastewater concentration. I think what we can really improve in the future is kind of reducing uncertainty around these estimates. So right now we can do it, but maybe we're not very confident in the number. So maybe we tell you, oh, there's somewhere between 10 and 10,000 people infected in your area. And it would be better if we could get that to like 900 to 1100, for example. And the ways to do that are things like shedding studies that I mentioned earlier, seeing how much virus infected people are shedding, and then understanding more of the kind of complexities of wastewater samples. So if you think sometimes there's more flow, sometimes there's less flow through your wastewater system, sometimes your samples are dirtier and sometimes they're cleaner, and kind of quantifying all of those things would lead us to better estimates. Maybe a question I have for other panelists, if they have an idea, is, how useful would having a specific number be to our public health partners? That's something that's not super clear to me right now.
I guess it depends on the disease, but Nicole, maybe that question, and then also the question of like how frequently would we ideally be updating these data? I think they're updated weekly mostly for wastewater scan and CDC. Is that correct?
Our
And
data, we get our data every 48 hours after the sample is collected. It'll be live on our
okay,
site.
okay, yeah, and just I'm sorry, some of it's a resource question as well as, but from a disease monitoring perspective, what would be ideal?
So I'll start with the shedding study and the sensitivity. So I just shared, and I think we can put it in the chat for the participants. So we have been doing studies on looking at what level do we feel confident that we could detect a case based on what concentration or detection in wastewater. So we did that for monkeypox, and this was clade 2. And so what we were able to note is that wastewater surveillance has a sensitivity of 32% for detecting a single mpox case in wastewater samples that represent thousands to millions of persons. And then sensitivity does increase as the number of cases increase. To those who have commented about the importance of shedding studies, you are absolutely right. That is one of the critical needs that we have for research in this field, that we are a newer field and we are learning as we go. And so CDC will hopefully be putting out some more information on a few other pathogens that we've been monitoring for with the sensitivity analyses. And those are important contributions and building blocks for this field. At CDC, we also publish our data weekly. And an important note for that is at the national level, we collaborate and we are interdependent with our state and local public health partners with the voluntary contribution of data that Wastewater Scan provides to us. And then we do get daily feeds from our national testing contract. So given how we receive data, and in order for any of our state health departments to have adequate time to understand what's going to be going up on the national dashboard, that is why we publish every Friday at a regular cadence. One thing we never want to do is surprise our state and local public health partners. It is very important that we have that respectful cross communication with each other so that we always know what's going up on the dashboard together and that we can have appropriate messaging and coordination for anything that may gather some particular public health interest. That said, along the same lines of what Wastewater Scan does, if we receive a detection or information about something that is not as we expected to receive, we immediately notify and have protocols in place to notify our state public health department leadership, our primary points of contact, and then they can message and communicate that as appropriate with their state level leadership to ensure that we are all aligned on the governmental side for how information is being understood, interpreted, and then shared publicly.
And there's a question in the chat also about the extent to which infections can be sort of localized. And maybe I'll ask sort of an extension of that question, which is, if it is possible to pinpoint infections, are there challenges or concerns there? And I'm specifically thinking of during COVID when people started looking for variants and possibly pinpointing variants to the level where maybe it was getting possible to track it back to individuals or hyper local information. that opens up, I think, a host of issues. So your thoughts on that? Whoever wants to chime in on these.
I can start because I also didn't get to the earlier end part of your question on equitability, but this is absolutely something that is on the radar. And at the international level, WHO is working currently on ethical guidelines for implementing wastewater surveillance, very much because of the concerns raised and the ethical collection and use of the data, the privacy concerns, the potential to target certain, groups or, religious groups or other marginalized communities. So, when you're talking about, so that's one issue, there's some good guidelines, hopefully, that are coming down that can be kind of utilized as countries are still early in kind of setting these systems up where they are still early. And to the equitability, point about, parts of the population that maybe aren't reached, that are being missed, that are kind of missing out on having the intelligence that could help, guide public health action in their communities. In a lot of the, countries where that is certainly the case, there also is a benefit, which is that these countries are starting from a point where they have a pretty well-established infrastructure for environmental surveillance for polio. So, a lot of countries are able to kind of take that, add additional targets, scale that up. So there is something already there, which is a benefit sometimes in those kind of underrepresented, underserved from a healthcare facility perspective communities that may not exist, in places that haven't been doing, environmental surveillance for polio for decades. So it's kind of a double-edged issue.
Yeah. Anybody else want to chime in on that?
Yeah, I would
Realizing.
just add that at Wastewater Scan, we take ethics very seriously. So when we were enrolling sites into our program, we set a minimum sewer shed size of 10,000 to ensure privacy of those locations that we were enrolling. We make sure to remove human reads from our metagenomic data. And I think we don't do any of that sub-sewer shed sampling where you try to track down where something came from. We think it's really important to kind of not do those things and ensure that we're maintaining privacy in the places that we're monitoring.
And I'll just build that we do the same at the federal level that Abby has laid out. The wastewater scan is outlined, and I'll just add one other resource. In addition to what Jean identified that WHO is doing, the Association of State and Territorial Health Officials also has published an ethical framework on considerations for wastewater surveillance and highlighting the needs for all of these similar parameters around ensuring that we respect privacy, that it is not to be used at the individual level, it is not to be used for punitive purposes, but to support public health at the community level and above.
And we have 2 minutes left, or really just 1 minute before closing. But just to say, there's legislation being introduced in the United States about wastewater. Does anybody want to give us a quick highlight of what that is trying to do?
Sure. So I'll just briefly say we've been thrilled that there's been some bipartisan legislation put forward. Senator Scott from North Carolina has recently been very vocal about it. It's called the PREDICT Act. And part of what it is able to do is authorize for CDC our ability to continue to sustain wastewater surveillance and to provide funding to our public health department partners to ensure that this resource can continue to exist. So this is the authority to do that. And then we would hope that it would support general authorization for funding, because as of right now, our robust and national system has been built entirely with supplemental funds, and there is no annual appropriation to support this domestic wastewater surveillance at this point in time. So we are grateful for the PREDICT Act that's been put forward, and we hope to see that move forward because they think that that will really enable this system to continue to provide the value that it's providing to public health and beyond.
Well, thank you for that. Really, thanks to you three. This has been a great conversation. I think we could have taken this twice as long, and if not more. And there's still lots of comments to address in the the chat here. And so we're going to make sure to copy those because I think there's just a lot of fodder here for future conversations. But I do want to thank you three for your time today and thank everyone else who joined us for this really, I think, timely and productive conversation. I also have deep thanks to my Pandemic Center team who helped put this event together: Bentley Holt, Michael Mitchell, Leah Lovegren, Amanda Kogan, Carly Gaska, and Chris Samancic. And if you want to stay up to date on future sessions, I think we're sharing a QR code on the screen, which allows you to access our link tree. And on there, you can sign up for our webinar mailing list, catch up on past recordings, and explore other resources like our weekly tracking report, which includes updates on topics like measles, flu, mpox, and other outbreaks, for which we are very grateful for the wastewater surveillance that's being done because it really helps us track those things. A recording of today's session will be available on the events page of our website next week, along with other previous webinars. So if you enjoyed today, please sign up and or share information about this with friends and family and colleagues. And you can also follow us on our social media channels. There's a whole bunch of them listed there. So in the meantime, we are adjourned. Thank you all. Be safe, be healthy, and stay engaged.